Welcome back to Ask Dr. Moore, and today we have another viewer question, and this one is in regard to my big toe joint replacement surgery video. Thank you for this informative video. I have arthritis on my joint area and very active with sports. Is cleaning up or joint replacement the best option for working out? Parentheses, run, jump, kick, etc. Actually, very good question. Most patients will be evaluated and told, hey, just do the best you can, wear supports. When the joint wears out, just get a joint fusion. Now, the replacement, again, is best for older patients or patients that aren't too active because the joint replacement will wear out. This is the silicone version that has more range of motion in the big toe joint area. There is another one that you can sculpt the head and put a metal cap on top, and also another joint that abuts that lasts a lot longer. But for this type of problem, especially with sports, I would do what he's calling the cleanup first. And there's a couple of things where you can drill holes in the head of the first metatarsal and also the proximal phalanx space and put an interface device in there that can keep the bone from rubbing, especially if you don't have any cartilage. There's other techniques. One I like that I use where I will do a small wedge of bone out of the side of the head. And what that will do is shorten it, open the joint, and if there's any spur, you can drill that off. Of course, still drill the holes. But that immediately gives more range of motion if you shorten the head, and then of course follow up with supports so there's more pressure under the arch and not jamming the big toe joint up in the air, which can also add to an accelerated degenerative joint. So yes, I would try other options if you're very, very active, and also if you're young. I would say around 50 years old is my cutoff. I have put in joint implants as young as 35, mainly very inactive people who want to pick that type of range of motion over a long-term final surgery like a joint fusion. Well, again, hope that was helpful. We have other videos that you can comment on. If you have any other questions, I'll do my best to answer them. Again, thanks for tuning in. Stay healthy and one step ahead.